Hi everyone. My name is Kate Godley and I'm the owner of the Functional Medicine Center. I'm so glad that you found our website today. So I wanted to tell you a little bit about myself, my professional and personal experience, and what has inspired me to practice functional medicine. So I hope that this gives you a little overview of the practice, and if you decide to become a patient, go ahead and navigate to the medical intake form here on the website. It is a secure form. So if you're willing to do that paperwork for us, it just gets the whole process started, and I look forward to meeting with you soon. So I wanted to start by just telling you my personal experience. I finished PA school in 2009, and I worked in infectious disease and HIV, and I became an HIV specialist when we moved down to North Carolina in 2011. And then I worked in infectious disease in the hospital for 2 years, seeing patients that were sick with opportunistic infections, as well as different things like hepatitis C, HIV, and syphilis. From there, I left the hospital to go have my second baby. And by then, my first had also been diagnosed with type 1 diabetes. So I had 2 little ones at home. So while I was home with 2 little ones, I became a yoga teacher. And then I studied and became a lactation consultant because I wanted to use what I had learned from breastfeeding for my 2 children. We tandem nursed for quite a while, and I wanted to be able to share that knowledge with my patients. So in addition to being a physician assistant, I'm also a lactation consultant. And then when I went back to work in 2013, I went back into family practice instead of infectious disease. This was also so I could use my growing knowledge of how I took care of my family in terms of nutrition and stress management. I wanted to be able to share that with my patients as well. And urgent care. I also worked urgent care then. And then it was actually, it was 2017 when we opened the doors of what is now the Functional Medicine Center. We started very small as a direct primary care. And when we moved one location to another, but within Durham, we changed the name to the Functional Medicine Center to represent what we were doing. So I went in 2017 when I knew I wanted to jump more into officially doing integrative and functional medicine. I went to ILADS, which is the Lyme Disease Association training. And it's an international conference, and there's also an exam, and you become what's known as a Lyme literate provider. For me, this transition was pretty straightforward because I knew beforehand that I disagreed with the Infectious Disease Society standpoint on Lyme, and I was very familiar with that from having worked in the hospital with patients, especially in North Carolina, where I could not get Lyme testing done, even though it needed to be. So I'm very familiar with. I also have a family member that has Lyme. I have 2 family members that have Lyme. I'm from New Jersey. And of course, my own experience with my son with type 1 diabetes has taught me about the world of autoimmune diseases. Both sides of my family, my husband's and mine, we have a lot of autoimmune, especially Hashimoto's, ALS or Lou Gehrig's disease, as well as multiple members with type 1 diabetes. So that's been a crash course, right? I learned so much about food that heals the gut and heals the liver, that I went back and I got a master's in nutrition and functional medicine. So I finished that master's degree in 2021. That was a 3.5-year program. It was 54 credits. It was kind of like a double master's. And that was at the University of Western States. And they partnered with the Institute for Functional Medicine to create a certification. So long kind of, path forward. Now I have all of the book training I needed to be able to incorporate functional medicine into a direct primary care practice. So I also am a patient, and I want to remind all new patients of this. I was diagnosed with Hashimoto's after my first was born, even though it had been missed for 6 months and was very frustrating. It had actually probably been missed for longer than that, but especially 6 months of symptoms, really severe. So I'm equally as frustrated at how few providers are ordering full thyroid panels when necessary. And because of my yoga training and my yoga background, I try to incorporate things like meditation or breath work for healing. How do we heal the parasympathetic nervous system? We talk about that in every single visit. I've also learned a ton from my HIV patients because some patients on HIV maintenance medications are very healthy and doing very well, and some of them are very sick. And so when you ask people what is the difference, that's really revealing. Usually it has to do with quitting smoking, stress management, healthy eating, whole body connection in terms of, and wellness in terms of mind body health. I also focus at this clinic on hormones and bioidentical hormones, and I've received additional training there because we know that bioidentical hormones are safe when dosed correctly. We have the research to back this up, and I see a lot of women, especially middle-aged, cis female patients who are really struggling because they're being ignored by their providers. Having said that, of course, we are LGBTQ welcoming, and there's a lot of our patients in that group that are obviously ignored and treated badly by providers as well. So just to put that out there. Mold toxicity is another diagnosis we see a lot of here, mainly because it's not recognized oftentimes by insurance companies, although I think we're moving ahead, trucking along there. But we see things like adrenal dysfunction or POTS or brain fog or neurological symptoms from mold toxicity. And no patient is the same. So our visits include a long time listening to your story, your history, and a full physical. And the first visit is always 2 hours. Sometimes it's a little bit longer. And our follow-up visits are always at least an hour. And this is because this kind of medicine, being really thorough, it takes time. And oftentimes we see patients who have seen 12 or 15 providers in the last 10 years, and we really need to listen and do a really good physical in order to get to the bottom of it, right? So we save a lot of time for those visits. In addition, I pride myself on being affordable, so we only order the testing that is needed at that time. It might take a little bit longer to get all of the answers, but usually the history and physical has given us clues, right? And we order only the testing you really need so that we're not giving you this overwhelmed fatigue. Plus, to me, financial health is really important. So I want to introduce you to some of our team members. Kristen Timpey is our nurse practitioner, and she has gone through the Institute for Functional Medicine's certification training. She's wonderful. Her background before that in nursing was cardiac, so I think we complement each other really well, and we do case reviews every week. So if for some reason you see one of us and you didn't see the other, it's okay because the other person's going to hear all about you. Lauren Light is our office manager, and she's the one that's going to get you onboarded and explain kind of the easiest way to communicate with us here and how things work. Lauren is also a massage therapist. Kelly Price Brewer is our wellness coach. She's in charge of our peer-to-peer, our community support group that we have here, which is free with your membership. She's wonderful. Jess is our medical assistant, Jessica Cox. And then we also have an intern, Swathi, who's wonderful. And then we have Josh Corwin, who's my husband, who does procedures here for IV ozone, PRP in joints, as well as stem cell treatment, different regenerative medicine things, but only procedures. And I wanted to tell you the two most common questions I get, just as you're watching this and I'm finishing up. People will ask me, how is functional medicine different from conventional medicine? Or another way to say this would also be like, what would you do for autoimmune thyroid? Something like hypothyroid, that's autoimmune. We call this Hashimoto's. What would you do that would be different than they do at another clinic? Well, we might put you on thyroid hormone, assuming that you need it and you don't have side effects. But we will use all different formulations, compounded, long-acting, short-acting, T3, T4 if needed. We'll use all different combinations of Armour or Cytomel or honestly, I think I have 200 thyroid patients and they're all in a different combination of thyroid. So that's the first thing, is you are an individual. And the second part of that is we're going to go back and look at what caused it right away. A lot of times Epstein-Barr virus will trigger Hashimoto's. So we need to go back and see what are your Epstein-Barr titers and how can we get Epstein-Barr to really be dormant instead of having flares of Epstein-Barr. We also can try to clear Epstein-Barr. That's a visit in and of itself, so I don't want to get too far down that. And then there's also the thyroid antibody. There's TPO, thyroglobulin, and thyroid-stimulating antibody. And all of those have to do with your immune system attacking the thyroid. So things that help with autoimmunity are going to help heal. So gut healing, right off the bat, liver healing. These are the tenets of functional medicine anyway. And low-dose naltrexone is often helpful, depending on the patient. And the dose depends on the patient and how you do. And always we're treating the patient and not the labs. The other question I get often is, if I haven't had labs, then what supplements should I be taking? Well, I got to say that's kind of impossible to answer without labs. But everybody needs magnesium because our soil has been depleted. So, having said that, I can think right now of one patient I have who can't tolerate magnesium. So we've had to do some different things to get magnesium levels up. But we always check red blood cell magnesium as well as selenium and cortisol and ferritin and iron when we do thyroid panels. Because I'm a physician assistant, I have a collaborating physician. So Dr. Salibi, JP Salibi is my collaborating physician. He is in South Carolina and he has his own practice, Carolina Holistic Medicine. He does not see patients at my practice. So if you'd like to see him directly, go to his practice. But he's a wonderful mentor to me and he's always available to do these case reviews, we call them. I hope that helps and you got to know me a little bit. Oh, I'll just leave you with my favorite thing about this type of medicine or job in general, career, is I get to see entire families. I really get to know people, and I love seeing you thrive and really take over your own healthcare. That is my goal, is for me to not be needed anymore. Our mission is really to facilitate safe space for healing, as well as collaborate with you, the patient, and to empower you. So those are the three parts of our mission statement. And I hope that resonates with you. And if it does, we look forward to meeting you soon.